Good morning to all of you. Welcome to the Satyame Vice Academy. Today we are going to discuss a question related to COVID-19. This is a question which has been directly asked in BPSC question paper this year. So, what is the question? Discuss the pattern of global spread of COVID-19 with respect to international migration and trade. So, the question is very specific. Either in UPSC or in BPSC, questions won't be direct from COVID-19. They would be taking COVID-19 as a help, and what we will try to do is that they will try to link other dimensions to it. Okay, like here they've tried to ask the question about the pattern of global spread of COVID-19 with respect to migration entry. So yes, we will our all the answers will follow a proper introduction followed by a connector and then body and conclusion. So, introduction COVID 19, which stands for Coronavirus Disease 2019, is an infectious disease which has claimed 1.48 million lives globally and is still counting. It has started with first reporting in Wuhan and is spread all over the world. Till here, we are speaking a very general line regarding COVID 19. But now, linking with the question, which is about with reference to international migration and trade, we added the next line migration of people and trade activities from disease hotspots to different parts of the world have resulted in massive spike of COVID-19 cases all over the world. So this is our introduction suited for this question, where we have talked about general COVID-19 also, and also about how we have linked it to the how its spread has been related to the international migration and trade. Now we will use a connector line. The pattern of the global spread of COVID-19 it can be understood in following ways. So what is the structure we are using? We're talking about the spatial pattern, and next we'll subsequently talk about the temporal pattern regarding the spread of the COVID-19. So if we talk about the spatial pattern, here we will take the continental approach. On 31st December in Wuhan, reported the WHO regarding a novel coronavirus, and within a time of few months, it has swept all over the world. So we will follow, as I told, continental approach. We will take the spatial approach. We will look first into Europe. Europe, being the tourist destination and an economic hub, was one of the badly affected regions due to coronavirus. We have seen the situation in Spain, Italy, UK, how they were badly affected. Also, how migration led to the spread. Repatriation of people from China and other affected nations added to the misery of Europe. Europe's trade is closely integrated with the global trade, and therefore trade activities also suffered a lot. So this is regarding Europe. Coming to the North America, in North America, mainly US, Canada, and Mexico, because of the lack of screening and preventive measures in the initial phase of COVID-19, it increased and the caseload increased in US and other North American countries rapidly. Also, if you look to the countries in US and Canada, the median age around these 40 years with comorbid factors which had added to the COVID death cases. Apart from that, North America is a global trade hub. We have big trading countries like US and Canada. Therefore, the trade activities and the migration of the people back to US and Canada or North America in general from the disease hotspot countries like China or for that matter Southeast Asia has led to the increase in the case loaded in North America. If you look to the graph, the if you look to the world map, you will realize that ki the countries which are in dark, deep red color, they are badly affected, with other countries least affected. We can see how North America is badly affected. Next, moving ahead, South America and Asia, Brazil and India, they have accounted for large number of COVID-related infections, and most of the countries in these regions they have poor and stressed health facilities, health infrastructure, even because of the poor implementation of lockdown. It resulted in the spread of virus to even remote areas also. In the case of India, we have seen how the virus it moved from the urban centers to the even rural areas because of the backward migration of the people. These countries, they are also the emerging economies of, and trade activities are heavily related with other countries also. This has resulted in the spike in the number of cases. Apart from this, India, especially India and Asian countries, they have done repatriation on a large scale, which had added to their COVID cases. But if you find Japan, it was having earlier experience of SARS and other respiratory disease. Therefore, it was able to manage the COVID more efficiently. So we analyzed it in South America and Asia also. Inward migration and trade, it has added to the caseload over there, and how it is spread over there. Africa, the continent which was least affected due to virus. Some of the reasons were given that the population is relatively young with better immunity. Even the trade, if you look at the trade of Africa, it's very limited to the rest of the world. And also migration is also very less. This is the reason, one reason why Africa didn't see such a surge in COVID cases as compared to other continents. So this was about the spatial analysis. Now we will doing the temporal analysis about that. That how with time the COVID cases they increased, attained the peak, and again came and again plateaued in some region, and again we are seeing a resurgence. So in the low stationary phase, in the initial phase, like in Wuhan, and very few cases were reported worldwide. But with no lockdown or screening at airports in the initial phase, it spread very fast. If you look in the peak period, what happened? Lockdown helped in achieving initial success, but with migrant exodus and partial opening of trade activity, it's resulted in massive spike in cases. If you look about the early stabilization period with effective implementation of testing, tracing, and treating, it has resulted in decline in daily number of infections. We can here do some innovation also. We can draw the graph. So we can draw graphs of various countries. Suppose for that matter, if you're taking China, there were the cases were reported, and then soon the cases plateaued over there. So China has plateaued its cases in the early March and April. Early March and April, China plateaued its cases. On the other hand, if you look countries like US, US there was a lot of caseload, and then it slightly decreased. But we now what we are seeing is this again a resurgence in the cases. In the case of USA, if in the same map using we can draw another map giving idea about India and Asian countries. In Asian countries, there was a spike in cases, and by the time we achieved plateau region, and now we are seeing another resurgence. So plateau was achieved somewhere near early September and November, and here the spike wave is seen in somewhere near the July and August season in Asia countries, in Asian, especially India. So even we can draw the graph of Europe. Europe also sees a large number of surge in cases. So we can draw a slightly clear diagram also. Uh, so this will give idea about that how with time, how with temporal analysis. This is about the temporal analysis that with time, how the COVID cases they got plateaued in some regions, and now we are seeing a second wave in some regions. So this graph will be very beneficial. Apart from that, what we are seeing now with the revival of economic activity and removal of lockdown, there is again spike in COVID cases with the permission to organize the public events. And recent festive seasons also, we have seen the overall increase in cases. Revival of economy and return of levels have also increased the cases. Rising air pollution. This is again leaded to the increase in total number of caseload. And now, with the onset of winter, there is second surge. We are seeing what we are seeing is the lockdown in Europe and all that countries. So, what should be the suitable conclusion for it? See, prevention is always better than cure, anytime. In the absence of an effective vaccine, we can resort to preventive measures such as wearing masks, following the hygienic practice, social distancing norms to deal with current crisis. Coordinated effort is needed at all the level. All the stakeholders need to be taken into consideration for the efficient and effective handling of the current crisis and for returning to normalcy. So This is the question. As I told earlier, UPSC won't ask question directly from COVID-19. However, they can ask some of the questions in PT related to that, but in mains it will be question will be the central theme will be COVID, and then it will attach one or two dimensions to it, and that will be a question of the UPSC and BPSC level. So thank you for today.